Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Today is January the 20th, and we're doing another one of our COVID conversations. We have a lot to talk about today because there's a lot of news in the world, some good, some not so good, but a lot of news to talk to you about what's happening with COVID. We've got a few good questions this week. They're on Facebook, questions at douglaspublichealthnetwork.org. So again, if you have a question for us, Facebook questions at douglaspublichealthnetwork.org, and we'll get to those. So let me tell you where we're at. So in the world, our number of cases are up. There's a lot of disease in the US, Canada, Europe. But we're also starting to see a lot of disease in Australia and in Southern Africa. And we're starting to see a heating up of disease in three areas that have had very little disease until the last 2 weeks. And that's in India, enormous number, over 1 billion people, Japan, and the Philippines, all of which have had not very much disease before. And we're now starting to see an increase. We're also looking to see what happens in Beijing after the Olympics. We know people are coming from all over the world and visitors and athletes. So we're worried that we might start to see an increase in cases in China. We think that cases have probably already peaked in the United Kingdom and in South Africa. They may be just about peaking in the US. US cases are probably at or near their peak, but that peak is really high. It's 3 times what we had in our previous high peak. So it's really a lot of cases, several days where they reported over 1 million cases in a day. Places that started early like New York, New Jersey, Massachusetts, Maryland, and the District of Columbia all seem to have peaked and it's starting to go down. I think the curve in New York shows really rather convincingly that after 4 weeks of rise, they've had now 1 steady week of fall. But there are places in the country that are still rising. I think Alaska, Hawaii, and Oregon started a little later, and I think they're still not yet at their peak. The one thing that we have noticed that the number of pediatric admissions is very high. So during the previous peaks, there were no more than 300 or so kids admitted per day. Over the last week, every day, we've been over 750. So a lot of pediatric admissions. And this seems to be because Omicron affects more of the upper airways. And kids, especially little kids, have smaller upper airways and seem to get into more trouble. And we've seen that here in town with a number of kids who've been diagnosed with COVID and have upper respiratory kind of illness. Now, upper respiratory illnesses in adults, we don't worry too much about. We've got big upper airways. They almost never cause us trouble. But because babies have such small upper airways, this sometimes winds them up in deep trouble and sometimes winds them up in the hospital. So that's what we're seeing. Oregon's at an all-time high. So we've had over 8,000 cases a day for the last week. We're at 186 cases per 100,000 per day, which is a lot. Our hospitalizations are high. Today, our hospitalizations were 1,104. Our previous peak was 1,258, and we're probably still 7, 8, or 9 days from the peak of hospitalization. So it's going to be problematic. The disease is especially hot in Deschutes County, where there are over 300 cases per 100,000 per day, and in the Tri-County areas. But those areas may have peaked at high levels, and we've not yet seen them come down yet, but they may have peaked. Douglas is very hot. We're going to report 194 cases today, 194 cases, one of our highest case counts ever. What we're seeing in Douglas County is that this disease is really contagious. So when one person in a work area gets it, everybody seems to get it, and overall seems to be less serious. Now, that still means that we still have people in the ICU, we still have people on ventilators, we still have people dying. So it's not benign. So less serious overall, which is a good thing, but not serious. I mean, when you think of other things that we have, like colds and other kind of things, nobody goes in the ICU for a cold. And when we compare it to flu, it probably is more serious than flu, but less serious than Delta. So flu is bad. This is both more serious and much more contagious. So probably 8 times as contagious as flu, but less serious than Delta. We are starting to also see that some places have so many cases that they're unable to carry on their regular business. The school districts are telling us that the bus drivers are getting sick and there's nobody to drive the buses. The hospitals had a lot of cases, even though a lot of people are vaccinated. And what we're seeing is that they're having trouble staffing departments. So, for example, they had a lot of illness in the lab, and so they've had to arrange to send labs out rather than being able to do them in the hospital. So that we think is going to be a double whammy. A lot of people sick, needing care, and at the same time, the people who are caring for them sick with the disease, and thus we may have our hospital system be stressed. So we've really worked on that. We've really worked to go ahead and see if we can decrease the stress on the hospital. And we're doing that in a couple of ways. One is we know that most of the adults who get admitted for COVID get admitted because they have mild respiratory illness and they need a little bit of oxygen. So in the past, a lot of times people got admitted for that oxygen, but we think many of those people could be treated at home if they could measure their oxygen levels at home and be able to bring home an oxygen source. So we work with local companies to buy a bunch of oximeters, and we're giving out to people at risk. And then we work with one of the local companies to secure a number of oxygen concentrators so that if people need to get them, we can be sure that they'll get them. We're hoping what we're going to do is lay off the hospital so that then the hospital can do the work for people who absolutely must be admitted. Other things we're seeing is antivirals are here. So with Delta, the REGEN-COV or Regeneron work pretty well. It does not work at all with Omicron, and that's a shame because it did seem to work pretty well with Delta. It does not seem to work with Omicron, and at least in the last couple of weeks, almost all of the cases in Oregon have been from Omicron. There are some oral antivirals, one called Paxlovid, one called Molnupiravir, which are starting to come out in town. Both are complicated drugs. Paxlovid has lots of drug interactions and requires lab work before you can start it. And Molnupiravir has got some other safety concerns. So they're there. They're not magic, but we think for high-risk people, they might be able to decrease risks of hospitalizations. Another study that came out this week, which has been widely reported, is that during the Delta surge, previous infection was pretty protective. And that's what we noted here too, is that if you had a previous infection during the last winter surge, you had pretty good protection from Delta. The CDC suggested that maybe previous infection was more effective than vaccination. We found that they were about equal. But what we're seeing is previous infection with Delta gives you almost no protection from Omicron. We look today, we have over 100 people who were sick with disease in August, September. So they had Delta, they were sick, and now they have Omicron and they're sick again. So we think that protection from a previous Delta infection does not provide good protection against Omicron. What does seem to provide better protection, although still not perfect, is that if you had the disease back in the summertime with Delta, please go get a booster, because we think the combination of a booster plus the disease probably gives you better protection. And again, it appears the best protection is in people who had both initial series and then a booster. And we're doing it every day. So there's a booster clinic every single day in the Fowler lot across from the Roseburg Public Library. And in that Fowler lot, you can get a first shot, a second shot, a booster shot, or you can get tested, or all of it. So please, if you're thinking at all that this is the time to get a vaccine, this is the time to get a vaccine, don't wait, get it today. We know that the booster takes a few days to get full effect, but we're still have another couple of weeks into this. And so we really hope that people will get vaccinated. The other question that we've gotten is, when is this going to peak in Douglas County? And again, remember, public health says we're like the weatherman. We can give you an idea of when the hurricane is going to hit, but you have to give us a little bit of leeway. What we've seen in other areas in the world, it's usually 3 or 4 weeks after the initial case that cases peak. We think our peak started around January 4th. So 3 or 4 weeks would be somewhere between January 25th and the first week of February. And again, predicting the future is difficult, but we think that's probably it. So I think we're in for another couple of weeks of tough time, but that we should get better. The other thing that we want to talk about is testing. And so testing has been an issue with a number of cases. It's hard to test enough people for it. The testing guidelines have changed. So the people who really should get tested are people who who are sick enough that they're going to need medical attention. So if you're sick, short of breath, sick, I can't keep anything down, sick with a high fever and you need to get looked at, those are the people who should be tested. If you're sick and just mildly ill, testing doesn't really add very much. We would like to know about it, but it's not going to change what we're going to tell you. What we're going to tell you is if you're positive, stay home. If you're negative, stay home. So it's not really going to change the advice on what we do. And going out to get the test may expose others along the way. So what we're recommending is that if you're mildly ill, think you have COVID, you probably do, stay home until at least 5 days, and then until you're well. And so when you're well and your temperature's down, then you can go back to work and assume that you probably had COVID. In addition, we used to test people who were contacts. And again, if you have a test or a home test, it's perfectly fine to use it. But again, now that we've shortened quarantine to 5 days, the test, you can't really get an accurate test until 5 days after exposure anyway. So it doesn't really change much your decision on going back to work. So we've really tightened our testing guidance, and I think that makes great sense. Now, if you have a home test and want to test, that's great. And we think there are going to be more home tests available soon. The feds already have a website where you can sign up to have 4 tests delivered to every mailing address. I did it earlier in the week. It's incredibly simple to do. Even I, who struggle with signing up with things on the internet, found it really simple to do. And they said they'll ship at the end of January. Now, I'll believe it when I see it. The other shipment of home tests is coming from the state. We're told that they should arrive any day now. We're going to get some tests, we don't know the number, and we're going to distribute them to some of our more rural populations who might have trouble getting to our testing site in Roseburg. So we're going to be working with our local fire departments to go ahead and deliver tests in the more rural areas of the county. What we're asking is people to get 4 tests per household. Again, if everybody's sick at home, you don't need to test everybody. Test one person if they're positive, assume everybody has the same thing. So again, we think 4 tests per household is a reasonable start. So as soon as we get those, we'll be distributing those at rural fire stations. We're going to be distributing on Meals and Wheels. We'll be distributing those to EMTs. So different places where people can go ahead and get those tests. One of the questions that came up is about the other antivirals. We had talked about in the past about the Regeneron, which doesn't seem to work. There is a little bit of another one called sotrovimab. And sotrovimab does seem to work against Omicron, and there are just a very few doses of that. And the hospital has those doses and are giving it to really high-risk people who are highly likely to get admitted should they get infected. So that's what we have for sotrovimab. The other question comes about masks. And I think we have made the guidance on masks really hard to understand. And so I'm going to repeat a story that I may have done last week. And so you remember we've said that public health is like the weatherman. And so if I was a weatherman and telling you that we're going to have a big, horrible blizzard coming out there, you wouldn't wear just shorts and sandals outside. You would probably get your best coat, your best hat, your best gloves to go out in that really bad weather. I don't think the weatherman has to tell you what to wear. Masks are a little bit more confusing. I will tell you, like with that, I will tell you now with so much disease out there, you should wear the best mask that you have. And what's the best mask? Well, the best mask is the best mask you have and can wear. So the N95 masks are the best. They're a little uncomfortable. KN95s, a little bit more comfortable. The KF94s, a little bit more comfortable. All really quite protective. The next level would be surgical masks. The next level down would be single level cloth masks. And the lowest level would be people who wear them on their chin. They don't provide any protection when you wear them on your chin. So again, we would recommend that during this time when there's a lot of disease around, try and avoid gatherings, wear the best mask you can when you're out, and recognize that this isn't going to last forever. Another question we get is, what's March and April going to look like? Is really, really, really hard for me to predict. But I look at data from around the world, and what we've seen in places like South Africa is that they had a big peak. They started they had the big peak, and they're down. They're not down to really low, but they're pretty much down, and their hospitals are decompressed. When we look at the UK, I think they're down. Their hospitals still have a lot of people in the hospitals. They're not totally free of this, but it's clearly down. So I think if I had to predict, The next 10 days in January are going to be pretty bleak. We're going to have a lot of cases, a lot of illness, and I think we're going to struggle with our number of hospitalizations. I think starting in the first or second week in February, it's going to start to improve, and by March be much better. And then I think come April and May, we're going to be down to a very low level of disease and be probably more to normal than we've been since this started in early 2020. That will be such great news. I'm hoping for an incredibly wonderful spring when we have low rates of disease, no need to wear a mask, no need to do these other kinds of things, and we can get back to our regular activities at a time when the weather in Oregon is just fabulous. Now, all of that is predicated on whether or not we get another variant. So one of our questions this week is, well, tell us about this variant. Well, this Omicron variant is very, very, very different from the previous variants. So we started off with the original strain back in the spring of 2020. In the summer of 2020, there was one mutation that took over pretty quickly called the D614G. So it meant the 614th amino acid changed one thing. And what that did was it made the spike protein more sturdy, and it increased the infectivity of that. We didn't have much again until the wintertime, when the alpha, beta, and gamma strains developed in the UK, probably in South Africa and in Brazil. And again, pretty much the alpha outcompeted the others, and the alpha had a big spike in the winter of last year. Then in the springtime, Delta came out, and Delta then had a big spike. So Delta was both really quite contagious and really serious, and that's why he had such a bad time of this in the summertime. It was then really quiet until November, when the Omicron started. And Omicron is so different. It has the D614G, but other than that, it doesn't share anything with alpha or delta, suggesting this did not come from alpha, beta, gamma, or delta, and this came up somehow totally new. And how this came up, we don't know. It may have been an immunosuppressed patient in Africa, and there's lots of them because HIV is not well treated in Africa, or it may come from an animal reservoir. There's one study that suggests it went from humans to mice, circulated in mice. This variant came back to humans and then out. And that's not shocking, because we know that with coronavirus, there are really big animal reservoirs. And so some diseases are only in humans, and so they only spread among humans. But then other diseases have both animal and human reservoirs. So for example, flu is in many different species. So there's pig flu and bird flu and whale flu, believe it or not, camel flu. So there's all these different flus in different species. And it appears now this coronavirus has spread from humans, clearly spreads in mink. And so there were big outbreaks among mink. And it now spreads to mice. It spreads to large cats like lions and tigers. It spreads to deer. So there's a big spread in deer. And the concern that we have is that it'll get into reservoir, spread in the reservoir, and then get back to humans. And so these rosy predictions that I have for the spring of the year are all predicated on us not getting a new nasty variant. However, I think with Omicron being so different from Delta, I think we're going to have a good level of immunity after this blows through. And after we have a good level of immunity, we'll still see some disease. And the question is, what does the world look like in 2023 with coronavirus? I think now, knowing that there's so many animal reservoirs, it is impossible to think that we'll ever be totally rid of coronavirus. I think the chance that we will be able to rid it in the human population and all of those animal populations is almost zero. So I think we're going to live with it. But the hope would be that we'd live with it with, 20 cases a week. And if we had 20 cases a week, we could deal with 20 cases a week. You would not need to see my ugly mug every week if we only had 20 cases a week. Because if we only had 20 cases a week and had effective antivirals, we'd have very few people in the hospitalization. And it would be important and interesting for public health to know what goes on. Right, when we have 10 cases of E. coli a week or 8 cases of syphilis a week, we still pay attention to it. So we would still pay attention to it, but it wouldn't be a state of emergency. and you wouldn't have to hear about it all the time. And we have syphilis and E. coli and Campylobacter every week, and you never hear me talking about it because it's pretty much under control. But my sense is we're not going to get rid of COVID, but it'll be in a time where it's going to be a relatively low level. Now, that all depends on not coming up with a new variant. So there's like the Upsilon variant that comes out from, say, mink, which has different mutations, and previous infection with Omicron or vaccination doesn't help. It's going to be problematic. But I'm hoping for a really good summer, a time for people to get back to the things that we all enjoy so much. So people say, well, Bob, in a few words, can you give us best advice? So the best advice is it's going to be really stormy weather over the next 2 weeks. Protect yourself as best you can. Wear the best mask you can. Avoid big gatherings if you need to. And clearly stay home if you're sick. If you are sick and need medical attention, please either call our hotline or call your doctor. Because we've seen a couple of cases where people get sick and then don't get care and die at home. So if you're getting sick with troubles breathing, troubles eating, troubles walking, if you could previously walk before, troubles thinking, you really need to call your doctor, because there are now some effective treatments that you could get. And so please do that. And the other thing is, don't panic. There's no reason to panic here, although there is reason to be concerned when there's so many people sick at the hospital and the hospital is going to struggle. We do worry about their ability to go ahead and not just treat people with COVID, but to treat any of us who might come up with a heart attack and get into a car wreck during that time. And then the last is, and we've said this before, if you're not vaccinated, please get vaccinated. If you're already vaccinated and due for booster, please get a booster. Again, our data shows again and again and again that those people who are vaccinated and boosted have far less disease and far less complications needing hospitalization than those people who are unvaccinated. And especially when we look at our deaths, so many of our deaths are in people who are either unvaccinated or got a dose or two many months ago. We've not seen very much severe illness or death in those people who have been both vaccinated and boosted. So please get a vaccine or a booster. And we have those every day from 10 until 5 at the Fowler Street lot, which is across from the Roseburg Public Library. No money changes hands. You don't have to give them insurance information. You basically give them your name and date of birth and address so they can put it in the state registry system, and that's it. I know a bunch of people have gone. They say it's really quick, really easy. And so please go ahead and do that. Again, if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll go ahead and answer them on next week's, or just send us the questions. I may even answer them before. But what we're asking for people, be safe, be kind, and recognize that we're going to have a tough 2 weeks, but then I think it's going to get markedly better. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thank you.